Hi, my name is Jeannie Smart. I'm the nurse administrator for the Nurse Family Partnership Program here in Los Angeles County. Welcome to our 15-year anniversary video, highlighting some of our nurses and some of our families to give you an idea of what we do here in Los Angeles County. The Nurse Family Partnership Program began in 1996 as part of a pilot project funded by the State Department of Juvenile Justice. At that time, Dr. Olds had done extensive research over 15 years to determine that this program was highly successful. The program serves the first-time pregnant, less than 28-week pregnant young woman who is living in poverty. These are the three intake criteria, and only the three intake criteria for the Nurse Family Partnership Program. The pilot project began after 3 clinical trials. The 3 clinical trials took place in Elmira, New York, and Memphis, Tennessee, and in Denver, Colorado. 3 different cultural groups, African American, Caucasian, and Hispanic, and all 3 of those groups showed very successful outcomes, I should say. About that same time, I think in 1997, there was an article that appeared in the LA Times that really facilitated our expansion throughout Los Angeles County. This article was called Orphans of Addiction. It described what was going on at the time in 1996-97. We were on the tail end of the drug-exposed infant epidemic. What happened after that article came out, however, was a request by the Board of Supervisors to look into how to prevent children from living in that type of an environment with a drug-addicted parent. What we came up with on a multidisciplinary task force was many different ideas, most of which never were implemented. But what was implemented was the idea at that point, let's expand a pilot site that we know is successful in changing the life course of mothers, getting them to stop drugs, getting them to stop criminal behaviors, getting them to be better parents for their children. And we began the expansion effort for the Nurse Family Partnership. In 1999-2000, we were able to expand this whole program countywide, and we've been going strong ever since. When we started the program, it was basically Tony Saenz Yaffe and myself, and we had to find a good nurse coordinator to help us roll out this program. At that point, we discovered Cindy Chow, and we brought her in to help with the full county rollout. Let's hear a little bit from Cindy about why she came to the program and why she stayed.
You know, I came to NFP 16 years ago, and I really did not know what I was getting myself into. I only came because it sounded like such an adventure, and I love program development and planning and evaluation, and I love nursing, and I love nurses. What made me stay? That I came to the realization of, you know, this program is not just about clients. You know, our clients are very important. That's why we're here. But in getting to know them, in being there for them, they in turn really change our lives. That the client is the expert of her life, and we are there to follow the client's heart's desire. It sounds really cliche per se, but to really practice it, it's a different story. And our nurses go in there thinking, I'm going to change the world, and they do. But at the end, it's that the clients change them as well.
As you could see, she had some special qualities that we wanted to bring in this program because we wanted to give our nurses the same things that our nurses gave our clients: unconditional positive regard, support to follow their own dreams, and all the help they would need to better serve the families, the very at-risk families that were enrolled in Nurse Family Partnership. Recruiting these qualified nurses, we were told, was going to be very difficult. And very interestingly, it was not very difficult. Many nurses wanted out of the hospitals. They wanted out of the short-term care that they were delivering in hospitals. They wanted to see the effects of their interventions on the families that they were working with. So they came to NFP in droves, and we interviewed many, many nurses over a long period of time. And over such a long period of time, we chose those that we felt had a connection, had an interest, and had a desire to serve some of the most difficult pregnant women in Los Angeles County. So let's hear a little bit about what brought the nurses into the Nurse Family Partnership Program And let's hear about why they stay.
To work with ladies who have difficulty accessing health care. So they're at risk. They and their babies are at risk. They have such tough lives. And to be able to go in and help them and to see them go from really struggling to succeeding, doesn't get any better than that. They're trying to be healthy. They're trying to be good moms. They're trying to work things out with their babies' dads. They're trying to get their education. They're trying to break out of this cycle of poverty, and they really, really struggle because they just they haven't been brought up with the tools that help them do that. And one of the great things I think that we do in this program is that we do provide them with the tools. We give them the support. We give them the encouragement. We help them figure out, really identify what their dreams are and help them identify those goals and help them to achieve them. And so sort of leading them to find their own way.
The challenge for me personally is that, and I understand the 5 principle, the client is the expert on their own lives, follow the client's heart desire. That's when it becomes difficult, when I see that they're not quite getting it and they are incorporating some other family or cultural practices that may not be to the child's best interest. And so that makes it a bit difficult for me, and try to figure out how can I best address this situation and provide more information that may increase the client's knowledge for change. But the difficult part is they may not. And it becomes difficult because I'm like, you gotta get this, you need to get this. But I know that's not the premise in what we do.
That nurturing part, I always thought, God, what happened? Why is he saying that about his mother? You know, the person who gave him birth, the life. And throughout my 16 years being there, I thought, it happens here, right in the womb. That's missing. And when I found Nurse Family Partnership, I kind of heard about it. I said, I want to work there because I want to show these mothers and these kids that bond that needs to happen when it's right here.
The goal aspect is very meaningful to me. I mean, I like to see, of course, we're not going to see the immediate results right then and there. It takes time. But getting them there is a satisfaction for me. It's like working together side by side and letting them know that there's someone there along their side that believes in them, that is there to guide them. Being able to at least have that compassion, and patience and understanding. I think that comes a long way, and it helps me to keep in mind that, you know what, I'm not going to see immediate results, but it will take time, just like it took time with previous patients. And the satisfaction is at the end that they do come back and thank you, and they tell you, or give you a phone call and tell you, oh, this is what I'm doing. I met my goal, and thank you for being there by my side.
So what's so important about having nurses do this work? There are many programs that don't use nurses to do home visiting to pregnant women and early childhood families. But Nurse Family Partnership is a little bit different. Our outcomes are phenomenal. They come after 2.5 years of sharing the life of a family that is enrolled in NFP. It encompasses changes in social services, welfare use, criminal justice, health, mental health, you name it. We impact every single functioning of that client's life. So let's hear from the nurses and some of the clients about why they feel nurses are so valuable and how they benefit the program and achieve such great outcomes.
There's a lot of things that go into this, and I feel that even when I had first started in this program, even though I had my training as an RN and stuff, only real experience can teach you, and once you start putting 2 and 2 together, initially when I first started, I'm like, she's just really quiet. And over time, you realize she's a little depressed. She needs someone to talk to. And then we were given training on motivational interviewing. And then you're like, you know what, maybe I can help her get through that if she doesn't want to go through therapy. Then you end up, there's a lot of background that goes into it. How we were taught about, yes, of course, maternal health. And then let's say her mom has a question about diabetes, she's going to ask you too. So then you have that medical surgical background that you can talk to her about, and when she needs to take her blood sugar, you know what I mean? And more when she uses you more as a tool for everyone else, you realize how much she trusts you also.
As nurses, the training that we get, and especially at a bachelor's degree or higher. The training that we get is crucial in helping us deal with the very high acuity that most of our clients have, whether it's mental illness or other health conditions, to have the critical thinking skills, the communication skills, the case management skills. Plus, as nurses, we are looked at as a very trusted profession.
I think it's important that it be a nurse because of the education. It's a combination of not just like physical health, but there's a lot of mental health components. And as a nurse, I feel that that's part of your education, not just physical, but it also encompasses mental health. There's nurses that work in psych, and sometimes you need that component when you're out there.
Ask you these things. Oh, he has a fever. Should I take him to the ER or not? I think that was the best thing, because although my mom was there and she was giving me a lot of help, she hadn't had a baby in so many years, 18, 19 years, because my brother, the youngest, is that old, Joseph, stop. Come here. Look. So definitely made a big difference that your background as a pediatrician also helped me, because my baby was in NICU, like a preemie. So I definitely had a lot of concerns, and you actually helped me a lot in that.
I was born with depression and anxiety. I've been through a couple mental institutions in my high school years for a little while, and that didn't really help much. But I feel like once you have the baby, it triggers it a lot more. But then again, you have this little human being that you made and you adore and would do anything for. I remember him being so colic, and he would cry all day and all night. And here I am being a new mom, and I didn't know how to handle it, this crying baby. I thought it was all me. And I remember calling you and talking to you, and you were just there to be a friend and help me and tell me that I'm a good mom and let me know that everything will be okay. I love that I am able to call you and ask you little questions like that and have you be there and support me. Yeah, you guys prepared me, obviously, before I had the baby. I was stuck in that room by myself that whole night of labor. So if I didn't know what you guys had taught me, what you had talked to me about, I would have been a wreck.
My medical background comes back as a pediatric rehab nurse. I worked with spinal cord, traumatic brain injury, muscle disease, as well as also adult neuro and stroke and medical med-surg. But with Nurse Family Partnership, I think my background in pediatrics has helped me a lot, especially when it comes to teaching my clients about safety. I get to let them know the inside of, okay, what the risks are if your child is not properly strapped in their car seat. I get to tell them, I was able to see the after effects, when children were not strapped correctly in their car seats and there was an automobile accident. I get to let them know as your toddler is growing up, water safety, why it's important to be careful with near drownings, in the tub, giving them a bath. I was able, unfortunately, to experience patients and taking care of them, under those conditions, with traumatic brain injuries. Also falls from two-story windows, not watching your children, making sure that the windows were locked, easy access of how toddlers can get around really quick and find their way out, and, preventing injuries. I'm able to do that with them. They ask a lot of questions, so it's having to be up and knowledgeable about what's going on. So I think with the pediatric background, it has made it a little easier for me to be more of a resource to my clients as well.
Because of the experience that I had as a nurse, because of the background that I have, because at the top of my head I can say gestational diabetes, wow, okay. And then knowing what it is and what I need to tell them how to change their lifestyle, it's not very hard for me. It's more difficult for them.
I want to be able to help people the way you've helped me and helped shape my life in a positive way. And I think I brought a lot of more modern child rearing methods to this household because a lot of it was based on old wives' tales.
As you heard, nursing is the most trusted profession in medicine, and the reason for that is because we are trained as nurse advocates in nursing school. We are trained to first serve the patient, not the doctor, not the hospital, not whatever system we're in, but we do what the patient wants. That same philosophy guides the behavior of our nurse supervisors, our nurse leadership, and all the way down the line in our program. It's vitally important that everybody get the support they need. The nurses have extensive experience in medical, general health, you name it, prevention. We're all public health nurses. And what we do is we make sure that we incorporate a lot of our training into the support that we give our clients. Let's hear a little bit about why we're able to give that support and what makes us so eager to do that. Because as you will hear, many of our nurses have been there, done that. They've experienced the same thing our clients are going through. They are of the communities we serve. Let's hear from them why they have such a connection with our clients.
Got pregnant at 15. I delivered at 16, and I didn't have a clue. And with that being said, I'm somewhat paying it forward. I can't understand everybody's situation, but I'm very compassionate about a young mother and her, where she is in terms of stages of development. It's a part where you kind of feel lost and you're looking for somebody to talk to or get some information from. So that keeps me with the program. Do I like the paperwork and everything and it changes? No, because I think I'm kind of I always thought I was flexible, especially when they say, oh, you have to be flexible in this program. I thought I was the poster child for that. But come to find out, I really found out something about myself. I'm not very flexible because I don't like so many changes so quickly.
I think that I give it my all. I'm very passionate about what I do. I see my clients not only just as clients, but I see them as the fact that, you know what, I was once there, or I can relate. I was raised in South LA by a single mother, a divorced mother, and I'm originally from New Orleans, so I actually came here and it was foreign to me. So I lived in South LA and that's all I knew.
I feel that I'm connected to this area that I work with. I see a lot of these girls and their families, and I see like a version of the family that I grew up in. I see a version of, hey, that was me when I was 15. I live 2 blocks away from where she lives. And just the idea that if I could plant one small seed, and even if I don't see that difference immediately, to know that that difference might happen, 2 years after I leave her, gives me satisfaction in what I'm doing. So I think it translates into you present a topic or you teach an idea or a method, and you might not see the results right away, but 2 years later, you might get a text or an email or a phone call from this girl that says, oh, I practiced. Remember when you came to my house and you told me about this? Guess what? I did it, and this is where we are right now. And me and the baby are doing great. It makes you feel like, wow, you saw this girl 2 years ago. You've already graduated her. And 2 years later, she remembers you and she's called you or she's written to you and given you an update on whatever it is you taught her that one time.
To me, I look at my clients, or I think of my clients as soil, ripe, just rich. Maybe at some point in time was a little dry, but if they said yes to our program, then I believe they're ready for something new. And so I think of myself as in the knowledge and experiences I have, as well as theirs, as a little seed that I'm just dropping in their lap, if you will. Maybe it's something they already know, or maybe it's something they're going to build upon. So I think of the seed as a experience and knowledge, and maybe a little building block for them, because they all of my clients come with some of their own personal experiences as well.
Nurses are expensive to use in a home visiting program, but the nurses we use in LA County and many places of California and the United States use public health nurses. That's pretty significant because what the role is of the public health nurse is primarily to prevent problems. We deal with safety, health safety, mental health safety, you name it. We deal with a lot of things that prevent illness and the cost to the government, to the counties, and to the communities. So let's look a little bit and hear what the nurses have to say about what we do in the prevention world.
How can I say? It's better to prevent than to mitigate.
We prevent them from things that could happen. In early prevention, in the pregnancy phase, when we're telling our teenagers or our clients to drink water and stay healthy and eat the right foods and take your prenatal vitamins and give your baby a healthy start, that to me, that's preventative.
But more important than our prevention efforts, more important than our time in the family, is the fact that the nurses develop a relationship with their client. Over 2.5 years, they bond. And as you heard Cindy Chow say earlier in this program, we are changed as much as our clients are changed in the course of helping them. We learn so much from our families, and we so admire their perseverance, their struggles, their strength, and their determination to be good parents. It makes it easy when you see that in a family. It also makes it easy when you have 2.5 years to develop that trust through a consistent approach of being always there for them when they need us.
I think the biggest part of what I teach them in learning how to trust someone or to be able to tell that someone can be trusted is the consistency. And it's not just the consistency of the scheduled visits, it's the consistency of if I tell you I'm going to bring you an article about breastfeeding, I'm going to bring you an article about breastfeeding. If I tell you that I'm available for you, I sort of set the limit for them, but I'm only available during these hours because when I'm off work, I'm not able to answer my phone. So creating the boundaries for them, setting the limits for them, providing that consistency.
The biggest takeaway for me would have to be that my client sees me as someone that's non-judgmental, sees me as someone that will listen to her, sees me as someone who trusts her judgment, will listen to her judgment, and someone who believes that we're doing this together. I'm not doing something to her or necessarily for her, but we're working together so that she can be the best parent she wants to be for her child.
It's like a safe haven almost, because you know that no matter what problems you're struggling with, that your nurse will be there to help you through them.
And it's not just the trust, the consistency, the skills, the determination, but sometimes it's just the perseverance of a nurse, searching for that person who needs her help and not giving up until that person accepts her help. It's not easy. If you're dealing with teenagers or if you've ever raised teenagers, you know it's not easy. So let's take a look at one of our more challenging, yet our more successful of cases that took place between Clarissa, one of our nurses, and her client, Corina.
Yes, we did that a lot to people. We would just lay in bed, and when we heard knocking, oh, that's Clarissa. She's coming to see us. Oh, darn, we forgot it was 9 a.m. Wow, that's early. Maybe if I just don't answer the door, she'll go away and call back and reschedule. In the beginning, I know I would dodge Clarissa, and sometimes I would, miss the meetings or I wasn't even home. But then after a while, I was really bad. And after a while, I noticed, this is fun.
But the real story of nurse-family partnership takes place in the story of our clients. Their stories of determination, their stories of pain, struggles, and their incredible strength. I want you to hear from them directly about what nurse-family partnership did for them and how they've succeeded and how they have struggled to succeed. We want you to see what we see on a daily basis and what makes us so proud to be a part of Nurse Family Partnership Los Angeles.
At that time, I was, scared because my sister had just announced to the family, my parents, my grandparents, that she was pregnant. And I saw the backlash, that she had. and how my mom said, you know, you're such a disgrace just because, you know, coming from a traditional Chinese background, you have to get married before you have a child. And again, my parents were going through a pretty messy divorce, so this would just add more fuel to the fire. It was difficult for me to open up in the beginning, but after our initial meet, I was able to, you know, be more casual towards you and not think that you're here to, like, you know, get me in trouble or stuff like that. I have been hurt for so long just because I was neglected and because I was going through domestic violence, and my parents didn't, you know, they were too busy and consumed in their own problems that they didn't really pay attention to what I was going through. It's a rough start, but I am so glad Clarissa was persistent and really, you know, got me to sign up to the program, because without people like you guys working for NFP and, you know, I don't think, you know, I would have been here today. And for all these other people who are involved, like, I just thank you guys for, you know, the persistence and, you know, the commitment to your jobs. So I'm currently a research assistant for 2 professors at USC. So I'm busy, but I'm learning.
When you feel that every door is closed or being slammed in your face for the mistakes you made in life, you know? And when you feel like you're not accomplishing anything daily, that is what it was. That was more of what my world was. It was like I was trying, but it wasn't enough. Or I would set goals and I was not keeping them. I wasn't. And now it's like, how can I not set a goal and keep it? Because what if she's looking at me setting those goals? What if she's looking like my mom said she was going to go to work on Tuesday? She still haven't went to work. Or what if, how can I teach her to accomplish goals and set goals if I'm not? So if I sums up my life before my pregnancy, horrible. If I say it now, wonderful.
I was scared because I didn't know if I could trust you, honestly. But once I got myself into the program, I realized I could learn a lot and wanted to be the best mom I could be. And to have patience. Because to have patience with a child is sometimes really hard. You guys have a great support system.
One thing about her, she's very honest. She's probably one of the most honest persons I know. I mean, she's just really honest. And we just clicked. We just clicked right away.
I was raised in LA, and my father passed when I was 3 years old, and I was in and out the foster system at 7, and I decided to stay in at 13. I emancipated at 19. I moved into transitional, got kicked out. I was homeless for a while, and I ended up getting my own place 3 years ago now. And, you know, hey, I'm here now. My son changed me. He made me, when I seen that face, it was just like, I can't do the same thing, you know. I have to change. And I didn't change the day I had him or the next day. It takes time every day.
It's like a lot of emotions that started flowing, because she called me and told me they took my baby, and I thought I heard her wrong. I said, who they? What happened? And she told me what happened. And but one thing that I just admire her about, she allowed me to assist her as much as I could and be a support for her, because there's other clients or people who may have the same situation, but they don't allow you to assist them in many ways, but she did. And so I was a part of her team to get Andre back, because I know that she was just the kind of person she is. She's so resourceful. whatever she could be hooked up with, she was. And I know she had the potential to be the greatest mom that there is. And so I supported her wholeheartedly. And at first I was like, oh my God, how did I feel? I felt her as a nurse. Maybe I should have, you start doubting yourself that maybe I didn't do enough, or it just was a lot of mixed emotions. But nevertheless, I said, I'm going to be there. I'm going to make sure she understands, what needs to be done. I'm going to make sure, but I'm going to be there for her, and I'm going to support her.
I need to start thinking on the other side where they're coming from, and not just the mother, oh, you took my baby away, anger. And like I said, wise mind. And I said, you know what? You're right. I do need to, first of all, research these child development so they can know that I know what child development are up to 6 months where he is, and also show them that I'm going to the Mommy and Me classes, participating, which they made me do, or that I'm asking for my visit. It was very relieving to hear this is what you can do and this will make it better. So when she told me, it was like an answer sheet, basically. Like, you're right, I do need to do this and show them, because I'm, like I said, I was down and out. This is my first child. I wanted my son. I was scared of the bond would be lost. Our breastfeeding, my milk was going to dry up and he wasn't going to get his nutrients. And then I wanted to be the mother. I didn't want somebody else being his mother, at the time. So it was stressful, but when I had my support system, as you said, it made me feel much better. It was like a massage, relaxing. Oh, yes, okay, I need to hear this.
I was 19, newly pregnant, living apart from my family for the first time, and in a not so stable relationship, and was very uncertain about where I was going to go with my life and what I was going to do raising a child, essentially what I thought was on my own. My family had just lost their home, so we were kind of spread out all over, not knowing where we were going to live. My dad had lost his job. My mom was fighting cancer. And it was just really a hard time. I embraced the situation that I'm in, the cards I've been dealt, and I'm going to make the best of what life has laid out in front of me. You guys have given me a lot, like as far as baby stuff, baby supplies, helping me stay motivated to breastfeed my son and giving me the support that I needed during this hard first weeks of doing that. Not be afraid or ashamed to seek help, because I feel like there's a lot of shame surrounding being pregnant at a young age, and it's important to look past that and seek the resources that are there to be able to ensure that you and your child have the best opportunity at success.
What's most gratifying to me is every time my client confirms an appointment or will call me and ask me if I'm coming, and or lets me into her home. And we have a visit where there's an aha moment. We might have been visiting for months on end, and all of a sudden we have a visit, maybe related to the baby, and there's a moment in my girls, and I can see it because subsequent visits tell me that she had a moment. She may share it with me, she may not. But that makes me feel good every single day. And I have quite a few of those every visit. Every week I have an aha moment with a client. So that makes me happy, and it makes me feel like I'm planting a seed every single time, every day. And every time I go, I water it a little bit, and then we'll see what happens. So that's what's most gratifying. And our relationship has evolved from there, from a very quiet, timid, uncertain young woman to a woman who's pretty certain about what she wants to do with her life now, and who loves her son very, very much. I can tell that right away. And very open to teachable moments. She wasn't closed. She would ask a question. What do you think about this? What about reading to baby, for example? And we'd talk about it, and she would be open to it. Next visit, she would say, you know, we sat down and I read to the baby and he sat for 1 minute. That's success. You did it.